Popular expression that you have a pinch nerve, pinch, un nervio pinchado.
A pinched nerve is a very simple, older expression that you really can't pinch a nerve. The nerve comes out of a segment or a tunnel, and that tunnel can get smaller. If you change the pressure on the nerve root, you can actually change the function of the nerve. So when somebody says they have a pinched nerve, there's pressure on the nerve root that is affecting somewhere else in their body, such as sciatica.
It's like the domino effect, right, doctor?
It's exactly like the domino effect because the joints are shaped like the gears of a clock. Once one thing moves, a variety of other things move, and you have to pick it up.
Hi, doctor.
Hi, how are you?
Good, good. Tell me, how good is the technology now to detect whatever abnormality we women have in the breast?
The technology is excellent. It's advanced over the years, and they've done a lot of studies for breast imaging, so there's been a lot of work done and a lot of effort put into getting early diagnosis, early treatment, and more cures. The reason you do the mammogram every year is to get the cancer when it's in its early stages and hopefully less than 1 centimeter in size.
Men should make mammogram?
A man should have a mammogram if he feels a mass in his breast or has pain in his breast. And then what we would do is we would either start with a mammogram and an ultrasound or do both at the same time.
What's your name?
Bravo. Dino. I bought the grape and I'm going to make wine because when I eat, I have a nice 2 glasses of wine. It makes me feel young.
Yes, I agree with you. What you coming here?
I come here every year to make wine. I love this place.
Why?
Yeah.
¿Por qué?
Well, they have wonderful grapes. The grapes from California, and they make wonderful wine every year.
How much did you buy?
I bought as much as I can put in my car one time. But I will be back. Here's my
That was good. What is the name of this procedure, doctor?
Name of this procedure is sclerotherapy of the veins of the hand. Well, you know, some people have more prominent, have a very thin skin with a very little fat underneath the skin.
So the three part of your body you had the varicose vein, and you solved it in just one section.
Well, it's a machine for skin tightening using infrared, absence of subcutaneous tissue in these areas, so it's easily wrinkled.
What is hyperhidrosis?
Hyperhidrosis is the medical term for excessive sweating.
What part of the body gets sweaty?
Well, it can actually affect any part of the body, but the most common areas that people are bothered by are their armpits, their palms, their feet, scalp. But it can affect, sometimes can affect the entire body.
Is the treatment safe?
Oh, it's very safe. It's done with a very fine needle, and there's such small amounts of Botox that we're injecting, so there's no effect on the general body at all.
How many treatments people need to do in this?
Well, you get results with just one treatment.
So people don't need more?
No, just one treatment. Now, it does eventually wear off, but we can repeat it in 6 to 9 months as the sweat starts to bother.
Is that covered by insurance?
In some cases, it isn't covered by the patient's insurance.
But yes, solve a very, very uncomfortable problem.
It's a very important problem. It can affect people not only in their social life, but as well as their professional life.
Thank you, doctor, for being with us.
Menopause is the phase that we go through, women, we go through at a certain time of our life. And the timing could be different, depends on our lifestyle, depends where we live, depends what kind of genes we're carrying. That could vary anything between age of 40, which is considered normal today.
What are the treatments to prevent the symptoms of menopause?
Hormone replacement therapy is different in form of the delivery into your blood system. It could be in form of the pill, it could be in form of the patch, it could be in form of the vaginal ring. There's a different vehicles to send it to your body.
How can a woman prevent fat from accumulating in her abdominal area?
We have to show you how to target that particular area with food, with exercise, and even with thought, believe it or not, that will fix that problem and keep that area under control. And osteoporosis is a very silent, very sneaky disease that usually doesn't show until it's too late. That's why after the menopause we develop humps, we develop hip problems, hip fractures, which can actually affect the quality of our life. You have to also make sure that you're taking supplements, drinking enough fluids, water, doing certain exercises to support and keep that beauty running.